Honorable Margaret Best is not able to be with us. Instead, we have Jean Lamb, who is the Assistant Deputy Minister, with us in her place this morning. And I know you're going to be happy to answer some of the questions from the audience, the webcast audience as well. Now, for the discussion theme today, it's healthcare. Health is your wealth. It is recognized that the greatest gains in the improvement of the health of Canadians over the next few decades will be in reduction in premature disease and death. A significant percentage of deaths in Canada from diseases such as cancer, heart disease, and diabetes can be reduced or delayed through primary prevention. What are the key preventative strategies and tools to help mitigate the burgeoning health and economic costs of chronic disease? Now, I'm pleased to present actually Jean. Jean is a strong background with this ministry itself. It's a strong component of its formulation and structure of this ministry. So I look forward to her input today. The Ministry of Health Promotion itself was established in June 2005 to provide a focal point for promoting health, active living within government and with the public. The ministry is responsible for the improvement, coordination, and delivery of programs designed to contribute to healthy and active living, and will champion the promotion of health and the prevention of illnesses and injuries as a gateway to improved health for Ontarians. Please welcome Jean Lamb.
Thank you very much, everybody. And as the Assistant Deputy Minister for Health Promotion Programs in the province, it's my great pleasure to be here today to take place in this peer-to-peer roundtable. I've already had a chance to chat with some of the members of the audience, and I think actually it's you who have many of the answers. But let me just start the session today by talking about some of the goals of the government, which is to help protect and improve health and well-being of Ontarians and to contribute to the sustainability of our publicly funded healthcare system. It's estimated that the province spends approximately 39% of its total budget on healthcare, and close to half of this amount is spent to treat illnesses that can, for the most part, be largely prevented. For example, about half of all cancer deaths can be prevented by eating healthy foods, by being more physically active, and by not smoking. And smoking alone is responsible for 90% of all lung cancer deaths in men and 80% in women. Our obesity levels, especially in children and youth, are skyrocketing, and so are the number of people being diagnosed with type 2 diabetes, and tragically, increasingly at a younger age. It is projected that by the year 2010, the number of Ontarians with diabetes is expected to be more than 1.2 million. This is more than 10% of our population. So these numbers deserve our attention. Many of these diseases, as I've already mentioned, are preventable, and that's where the Ministry of Health Promotion's mandate comes into play. Our focus on awareness, prevention, and personal responsibility for health will help reduce the need for costly treatment interventions. Since the establishment of the Ministry in June 2005, the Ministry has been engaging partners across the government and in Ontario's communities to support a healthier, more active province. Our primary goals are to promote and encourage Ontarians to make healthy choices at all ages and stages of life, to create healthy and supportive environments, to lead the development of healthy public policy, and to encourage the adoption of behaviors that promote good health. The 5 priorities for the Ministry of Health Promotion include promoting health and wellness, nutrition, healthy eating, preventing disease, injury, and addiction, valuing sport, and partnership support for healthy communities. Well, we obviously can't do it alone, and nor do we want to. By working with partners to heighten public awareness of health and chronic disease prevention, the government is contributing to the following objectives that are linked to the determinants of health as identified by the World Health Organization. So we are providing support to increase levels and access to physical activity and sport participation, to increase awareness and adoption of healthy eating practices, and if I might put in a shameless commercial plug for our Dietitians Advisory Service.
Sorry, Jean, we're having an audio in the back. If you could maybe, we're trying to adjust the volume, but if you want to maybe speak up into the mic as well.
Okay.
Please turn off the...
I'd be glad to.
That has nothing to do with it.
Anyway, I will speak loudly, and I'll do my promotion a little later. Also providing increased access to quality after-school programs. We're working to increase the awareness of type 2 diabetes, particularly within high-risk populations. And of course, we're increasing awareness of the harm associated with tobacco use and substance misuse. Now, to reduce barriers and improve the health of all people where they live, work, learn, and play, we know that we must focus more broadly on the underlying personal, social, and economic factors that contribute to health. So we can make a difference in the lives of people when we, governments, the healthcare providers, stakeholders, communities, and individuals share responsibility for improving health. None of us can do it alone, but together we can contribute to changes that support better health for people at all ages and stages of life. Thank you.
Thank you very much, Jean. And our next panelist is Pat Campbell. She's the CEO of ECHO Ontario. ECHO Ontario's new women's health agency was established by the McGuinty government in 2007 to raise awareness and work towards solutions on women's health issues. And please welcome Pat Campbell here today. Thank you.
Good afternoon. I'm very pleased to be here and be part of a panel on health promotion. My organization is a new agency formed by the Ministry of Health and Long-Term Care, developed to be the focal point and catalyst for women's health in Ontario. And that includes promoting equity and achieving all of that through collaborative partnerships. So we are just getting started. So despite the fact it was announced in 2007, 2009-10 is our first full fiscal year. There's tremendous alignment of the goals of the Ministry of Health Promotion and many of its key activities and the things that most concern us. Particularly, the Ministry's focus on heart health, osteoporosis, stroke, and smoking are key areas of interest for ECHO, as they are great concerns for women's health. One of the things that most concerns us in women's health is chronic conditions. On self-reported health status, women are more likely to report chronic conditions. They're twice as likely to suffer from depression compared to Ontario's men. And that means that somewhere around 6% of women will have experienced depression in the last year. So tremendous burden of illness in that. Autoimmune diseases are more prevalent in women. And one example of that is 35% of low-income women aged 65 or older report activity limitations due to pain. And of course, that impacts on independence, which is a key factor as we start to look at the sustainability of our healthcare system. So there must be recognition that in health promotion, that women face unique circumstances, either circumstances that aren't faced by men, like childbearing, or are more significant in women because of the social roles that they play, like caregiving. And so health inequities are a major focus for us. We have in this province large and preventable or remediable disparities related to income, education, ethnicity, and geography in this province. And it's time that we all work together to start to address some of those challenges. Women need to be supported in taking an active role in managing the health issues for them and very often for their family through good access to primary care, consistent evidence-based approaches to care delivery. We know that there are barriers to accessing care based on current evidence, what people are coming to call the know and do gap. We know certain things, but we don't necessarily have those available in practice. And we need to continue to explore the implications of the fact that every cell is sexed and every person in our society is gendered. And as we're moving into the era of personalized medicine, what are the implications for that as we move forward? So health promotion is key, no matter what your health status, whether you live with a chronic disease or not. I look forward to the dialogue that we'll have here this afternoon. Thank you.
Thank you, Pat. Our next panelist is Judith Plotkin. She's Vice President of Business Development for Human Solutions. Now, Human Solutions is an employee support workplace and organization health services company. Its philosophy is to contribute to the health, wellness, and functioning of the organization through careful human solutions, responses to the mental, workplace, and health needs of its members. Please welcome Judith.
Thank you. Well, I'm here representing Human Solutions, and we're a private sector company. So I'm going to speak on behalf of those of us, speak on behalf of those of us that work with employers. We provide disability management, mental health assessments, and EAPs, which offer primary prevention, such as smoking cessation, nutritional counseling,